Towards the end of the first quarter of 2021, the numbers of daily COVID-19 cases were falling and the dreaded second wave was almost over, so it seemed. But at the beginning of July, cases started climbing again, especially in Lagos. The governor of the state, Babajide Sanwo-Olu, who said the positivity rate had gone up from 1.1% at the end of June to 6.6% as at July the 8th, gives increased isolation center occupancy as further proof. This was corroborated by the head of the isolation center at the Lagos University Teaching Hospital.
Once you see that the numbers are going up and it's consistently so, you have to have a high index and say, okay, this is what's happening. Among those people testing, how many of them are turning back positive? It's a very huge marker at hospitals and at health facilities also. When you see the number of people who are reporting with these symptoms increasing, and that is why the reporting system is fashioned in such a way that at facilities, there are, of course, we know there are what's called disease surveillance and notification of DSNOs.
In the early days of COVID-19 in 2020, contact tracing helped keep the infection contained. The story is different now, even though Delta, a variant of concern, is now on the loose. The Delta variant is reputed to be at least 50% more transmissible than the others.
Well, the truth of the matter is we stopped contact tracing as soon as we had transited into community transmission, which means that the virus was everywhere. Is now everywhere. There's no unidirectionality about it. It's not from one person to another. It's one person can affect 1.6 people, or better still, 10 people can infect 16 others. Oh, this Delta variant has been found to be 50% more transmissible.
Ironically, restrictions on the populace are not being increased. The simple instructions remain the same.
The issue is back to hands, face, space. Wash your hands, wear a mask, maintain physical distance.
Now the message is, there's a new virus in town. This one is even more easily transmissible. So simply step up doing what you were doing before. Only this time, do it more effectively.
Religious houses are also allowed a maximum of 50% capacity at any time. Unfortunately, according to the Lagos State government, 18% of travelers into the Muritala Mohammed Airport in Lagos provided wrong contact details, making it impossible to monitor them. The borders remain cautiously open in an attempt to balance life and livelihoods. Passengers from India, South Africa, Brazil and Turkey are required to observe a mandatory isolation period on arrival.